Breast cancer is the most common cancer in women worldwide. But here's the good news. With early detection and better treatments, survival rates have improved dramatically over the years. Today, we're going to cover who is most at risk, how breast cancer is screened for, the main management options, and what life looks like after surgery. By the end of this video, you'll have a clear understanding of the journey from risk to recovery. So, who is at risk? Anyone can get breast cancer, but certain factors increase the risk. Number one is going to be age. The risk rises with age, especially after 50. Number two, their family history and genetics. Having a mother, sister, or daughter with breast cancer increases risk. Mutations in genes like BRCA1 and BRCA2 can raise lifetime risk up to 70%. Number three, hormonal factors. Early menstruation, late menopause, never having children, or long-term hormone replacement therapy can increase exposure to estrogen, which is linked to risk. The fourth one, which you can modify, is lifestyle factors. Obesity, lack of exercise, alcohol use, and smoking play a role. But remember, risk factors don't guarantee cancer, and many women with no risk factors will still develop it. That's why screening is so important. The goal of screening is to detect cancer early, when it's most treatable. How do we do that? We actually use the mammogram. We perform mammography. This is the gold standard. Women at average risk should start mammograms around age 40 to 50 and can continue every 1 to 2 years depending on guidelines in their country. Higher risk groups, those with BRCA mutations or strong family history, may need screening earlier, sometimes with MRI in addition to mammography. The last screening tool is actually your self-awareness. Self-breast exams aren't perfect for screening, but being familiar with your own body helps you notice changes, like lumps, skin dimpling, nipple discharge, which always should be checked. So, the next question would be, what are the management options when a patient is diagnosed with breast cancer? Well, if breast cancer is diagnosed, the treatment plan depends on the stage, tumor type, and patient preferences. Here are the main options. First one is going to be surgery. This can be a lumpectomy, removing just the tumor, or a mastectomy, where the entire breast is removed. Lymph nodes may also be tested or removed to check for spread. Number two, radiation therapy, often used with lumpectomy to kill any remaining cancer cells in the breast. Number three, chemotherapy. These are drugs that target fast-growing cells, sometimes given before surgery to shrink tumors or to prevent recurrences. Fourth one is hormonal therapy. As mentioned, hormones affect and influence this type of cancer. For cancers that are hormone sensitive, medications like tamoxifen or aromatase inhibitors can block estrogen. The fifth one is targeted and immunotherapy. These are specifically for HER2-positive cancers, which may be treated with drugs like trastuzumab, and immunotherapy is emerging as an option for certain aggressive subtypes. So if you do have surgery, what do we expect as outcomes after? Well, surgery is not the end of the story. Recovery and survivorship matters as much. The physical recovery, patients may experience pain, arm swelling because of lymphedema if a nodal dissection is performed, or sometimes even stiffness. But physical therapy and exercises may help restore movement. There are reconstruction options. Some women choose breast reconstruction with implants or tissue flaps, while others embrace the natural appearance. Both choices are valid and personal. The third one is actually emotional recovery. Coping with body image, fear of recurrence, and mental health is part of healing. Support groups and counseling make a huge difference. So what are the outcomes today? Thanks to earlier detection and better treatments, the 5-year survival rate for localized breast cancer is over 90%. Survival drops if the cancer is advanced or spreads, which is why screening and timely treatment is so critical. And survivorship doesn't just mean living longer. It means living well, with attention to quality of life, family, and long-term health. Breast cancer is a tough diagnosis, but knowledge is power. Knowing the risk, getting screened, understanding your treatment options, and seeking support after surgery can make an enormous difference. If you found this video helpful, please click the like and subscribe button and type your questions or comments down in the chat. And check out the other videos we have, and I'll see you guys next time.